Welcome to AETCM, the Emergency Medicine Channel. Today, we are going to discuss about a new drug, Labetalol. So, Labetalol, as the name suggests, it's an alpha plus beta blocker. So, Labetalol contains a LOL, which is a part of a beta blocker, and A, which also include Labetalol. There's an A also, which means that it contains both alpha plus beta action. So it is an antihypertensive drug. So the beta action is beta 1 and beta 2 receptor. The beta 1 receptor which help in the decrease in the heart rate plus force of contraction, and the beta 2 receptor cause a vasoconstriction which is in the very minimal state, and the alpha blockade which causes vasodilatation. And here we can give the Labetalol as an oral drug or as an IV drug. Here oral drug the dosage range from 100 to 300 mg, and IV 5 mg per ml. And coming to the uses for Labetalol, mainly Labetalol is used as an antihypertensive drug, and also it can be used in acute aortic syndrome as well as aortic dissection. Here you have to reduce the BP and keep the BP less than systolic BP less than 100 to 120 milligram per mmHg, and the heart rate less than 60 mm. So here initially we will give the Labetalol as a intermittent bolus doses like 20 mg over 2 minutes, followed by we'll double up the doses to 20 to nearly up to 80 every 10 minutes. If the BP is not getting controlled with the initial intermittent bolus doses, we will then go with the continuous IV infusion. Here we give the dose like 0.5 to 2 mg per minute, and sometimes it can be a maximum up to 10 mg per minute. So it can be used in acute ischemic stroke also. Here you have to maintain the BP at like less than or equal to 185 per 100 mmHg. So here we'll give the Labetalol can be given like prior to reperfusion therapy and during and after reperfusion therapy. Prior to reperfusion therapy, we give intermittent bolus doses like 10 to 20 mg per minute, and followed by after reperfusion we can give 10 mg over 2 minutes, followed by continuous infusion to 2 to 8 mg per minute. Next, can be also used for acute or severe hypertension. Here intermittent boluses are given like 5 to 10 mg, 5 to 20 mg IV boluses are given. Can also be used in chronic hypertension or chronic resistant hypertension. So here oral doses are more used, like 100 mg twice daily. It can be titrated to 200 and then a maximum of to 800 mg per day. And other usage Labetalol is in hypertensive emergency. Here initially we will try to control the BP with intermittent bolus doses 10 to 20 mg, then maximum titrated up to 80 mg. And if it is not controlling intermittent bolus doses, then we will go with the continuous IV dose. Here 0.5 to 2 mg, maximum up to 10 mg in some textbook can be given over a minute. So can also be used in case of hypertensive emergency in pregnancy and postpartum. So intermittent IV can be tried initially, and if it is not, we'll go with the continuous IV. And also it can be used as an oral drug also. The same Labetalol can also be used in case of intracerebral hemorrhage and also subarachnoid hemorrhage. Here also we'll try to control the BP with intermittent bolus doses. Then if it is not controlling, we'll start on with the continuous dose. So next part we have to look with about the side effects which are occurring following the usage of Labetalol. So main side effects include fatigue, dizziness, then orthostatic hypertension, flushing, nausea, and drowsiness. And you can also see anaphylactic reactions, floppy iris syndrome in case of cataract surgery can be, then hepatic injury can be there, and also patient can develop hypotension and syncope. So the Labetalol is an antihypertensive drug will conclude, and the action is via alpha and beta receptor. And so initially we can have IV oral doses, oral dose maximum up to 800 mg, and IV doses, intermittent doses can be given. If it is not controlling, we can go with the continuous doses, intermittent bolus doses like 1 to 2 mg, 5 mg, 5 mg to 20 mg. And if it is not controlling, we'll go with the continuous doses 1 to 2 mg. That's it about labetalol. Thank you.